This paper is called Evolving an Evidence-Based Model for Homelessness Prevention. The purpose of the paper was to take the quite popular homelessness prevention model developed by the Homeless Hub and think about a piece that I felt was missing. This paper was written by myself, one of my PhD students, as well as Aaron Day and Steve Gates out of the Homeless Hub, who created the original model. So the original model has 5 pieces. The first is structural prevention. In terms of structural prevention, not surprisingly, we're thinking about the highest level of our social structures, things like income assistance, things like the housing market, and considering how these might be designed so that everyone has a place to live. The second level is systems prevention. In terms of systems prevention, we're thinking about how our public systems may or may not contribute to homelessness. So for example, if people are being discharged from the hospital to the street, then obviously our systems are creating homelessness, and we can prevent it by ensuring there's no discharge to no fixed address. The third element is early intervention. So early intervention is thinking about things like housing first, where we take people in a shelter situation and put them directly into housing. Or this might be in other spaces as well, such as how we help people who are couch surfing from not ending up in the homelessness system at all. The fourth element is eviction prevention. So how do we help people sustain the housing that they already have? The fifth and final element is housing stability. So housing stability is as people are rehoused or are entering housing precarity, how do we stabilize them into the housing that they already have? So these were the 5 already written elements of the homelessness prevention framework by Aaron Day and Steve Gates. However, as a nurse, we also think a lot about prevention, and I've taught public health and I've taught the different types of prevention. And so we talk about primary, secondary, tertiary, and quaternary prevention. Slightly different language, but in a lot of ways thinking about the same elements that are in the prevention framework. However, the quaternary prevention was something that I felt was really missing from the framework and missing from a lot of the literature. Quaternary prevention thinks about how do we prevent our own systems from harming people? How do we look at our own services and consider how they might be making things actually worse? And around that, a lot of my own research has been in the idea of improving the experiences of service users. So as a nurse working in primary care, I looked at what are the best ways to develop empowering relationships between patients and people like nurses and doctors and social workers. So quaternary prevention reflects on the fact that our own services can actually do harm to people if they're not provided in dignified and empowering ways. So to write this paper, we looked to the literature. And we looked at everything that had been written about prevention, and we looked at the different ways that people were reporting on the service provision to help people experiencing homelessness and where things had gone wrong. And so this led us to writing this paper where we are offering a 6th element to the prevention model. And that element we've simply called empowerment. The idea of empowerment is not this sort of pejorative perspective that we as service providers have power and we're going to give them to the people we are helping, but instead to think about empowerment as people have power and we can create spaces and provide care in ways that help them build out or access or enact that power. And so what's important in the prevention framework when we think about empowerment is to ensure that our services are not doing harm in the way that we're delivering them. A good example of this would be around housing first. When we think about delivering housing first, there's often a lot of pressure on a couple key statistics, such as rehousing people and how quickly they're rehoused. When people who are housing first providers have this pressure to really rapidly rehouse individuals in really constrained housing markets, they may find themselves sort of forcing people into particular units. This is written in the literature, and that can be disempowering. And so we don't want to create a situation where then people decline to engage with the service. That leads to a breakdown in relationship, limited support, and eventually they're evicted without the supports they need to stay housed. So that's one example of how if we disempower people through our services, we can actually perpetuate cycles of homelessness. So in looking at the literature and thinking how we can then empower people, we found 4 clear recommendations. The first is including the voice of service recipients in the care that we're providing. This means authentic ways to engage people. And we have a lot of good literature, even from healthcare, looking at patient users of services as experts in those services, that we can build upon in the services we're providing to end homelessness. So making sure that the people we're rehousing have real, tangible ways that they can have a voice in things such as the policies of the programs that are supporting them. The second thing we heard, which is maybe a bit more specific than the other recommendations, but is still important because it came up in a number of our articles, is to think about the relationship between the criminal justice system and the services we're providing around rehousing. This included papers we were reading about things like having police involved in mental health services and how difficult that can be for particular populations. Or if you're offering a shelter and the justice system is ordering people to reside in that shelter, what that means in terms of the access of justice services into that shelter space. So for many people, they don't have a positive relationship with the justice system or with police. And so one way we can be cautious around disempowering people is to make sure that those services aren't coming into spaces where people are then not feeling welcomed and not able to access that care. A third thing we learned, which builds on my example from Housing First, is the importance of consumer choice. And so while the housing market is very constrained, as much as possible, we need to find options for people. These can be geographic options or options in things like whether people want to live in a scattered site unit or they want to live in a more congregate unit such as supportive housing or social housing. The fourth and final way that we can help empower people through services is to really think about long-term social integration. So often in providing care to those experiencing homelessness, the focus is very much on getting people rehoused, and with limited resources, that can often become the primary or even the sole focus. However, as people look to have a better life after being rehoused, integration into their community, building more natural networks, and having access to the resources they need to live day to day is also vitally important. So we can empower people by providing access to other sorts of supports and services beyond just getting people rehoused and just making sure that their rent is paid. So overall, we thought it was important to think about the idea of quaternary prevention, that if we can make our services as positive and as empowering as possible, then we can also reduce returns to homelessness. And so hopefully, in thinking about this as either a service provider or a researcher, you can think about how empowerment can become a priority in services for people experiencing homelessness. For future research, I would love to see how organizations could actualize empowerment, how they would pick this up, and different ways they might think about including participants in decision-making, including social integration into their services, and those other factors that we think are important for empowerment to work.